Dear doctors, today we will learn planes in diagnostic imaging. Planes are very important to understand in a CT scan, in MRI, as well as in ultrasound. Basically, there are three planes: axial, sagittal, and the coronal planes. The axial plane means something like you are cutting in two parts, in two halves, top and bottom. That is the axial. Likely, suppose I'm cutting the body into two parts and then seeing the part which is cut down. That is your axial plane. The next plane is the sagittal plane. This is basically midline plane, and you can see if I cut the body in the midline from right to left or left to right, this is sagittal plane. This axial plane is also called as a horizontal plane. Horizontal plane. And this sagittal plane is also called as a vertical plane. The next we have the coronal plane, that is the perpendicular to the axial and perpendicular to the sagittal. Suppose I cut the body from this side, right angle to the midline, that is your coronal plane. Now, to understand in a simple format, just see, suppose this is a human body, then I am cutting different parts, I am taking the sections of different parts, that is your axial plane. So in the axial plane, you can take different sections, different slices. These slices could be of various size. This could be of 1 centimeter, 5 millimeter, 2 millimeter, or even less than 1 millimeter. Likely, if you cut the body in different mid part, you will see from right to left or left to right. This is a sagittal plane. And if you cut the body from this side, perpendicular to the midline, is a coronal plane. So this is your axial plane, this is your midline or the vertical plane, or this is your coronal plane. You can see here in this part, in this axial plane, you will see this is the posterior, this is the anterior, this is the right, and this is the left. So by default, this is right and this is left, because what we think, we assume the patient lying on the table in front of you. In that case, this side will become the right, this will become left, this is the anterior and posterior. In the case of the vertical plane, in the case of the sagittal plane, this will be the superior part and this is the inferior part. In the case of uh, coronal plane, you will see this is part is superior, this is inferior, this is again right, and this is again left part. So we will meet again in next class with some few basic points. Today I think this is sufficient to understand. Thanks.